everyone. I'm Maggie McGrath, editor of ForbesWomen. Caregiving and childcare are two of the top issues in the 2024 presidential election, or at least among women. Joining me now is a woman who co-founded a company dedicated to caregiving, but is also living the issue herself. She is 8 months pregnant and navigating how to go on maternity leave while running a startup. Julia Cohen Sebastien, co-founder and CEO of Grayce, thank you so much for joining us.
Thank you for having me, Maggie. I'm glad to be here.
So I want to talk to you about your personal journey, but also your entrepreneurial journey. And since this is Forbes, I'm going to start with the latter. Tell us about Grayce, which earlier this year raised a just over $10 million Series A from investors like Maveron and BBG. So you're attracting the venture community. What exactly are you building?
Yeah, so we're building a solution that really helps people in caring for loved ones or themselves in that journey. So it's one part a dedicated social worker who helps to guide you through everything in your journey and support you on taking things off your plate. And another part technology and helping you to navigate things on your own time and your own terms.
How does your company differ from other caregiving options out there? I know there's Wealthy. I know there are a number of caregiving concierges. I know there's care.com. What does Grayce offer that these other companies don't?
Yeah, so I'd say my background before starting the company really came from healthcare. And so I see a lot of things through the lens of population health and thinking about long-term outcomes for every individual family. And that comes from our care model. So we really think about who we hire in helping people with our services and starting from a social work-based care model, which really looks at every individual and every family's social factors. It looks at the context of their lives, their community beyond their family, and then really thinks about how they put together those strategic plans and how they actually then navigate the community and all of the resources that are available to them. That's really something that social work is the best field in guiding people through that process. So that's unique in the way we think about that care model, the way we don't just coach people, we don't just make recommendations, we don't just make referrals, but we actually are in the trenches with them and we take things off their plate. A lot of folks don't do that. We don't think this is a topic of self-help, right? If you think about where people are today in navigating care, it's not that you're not doing a good job, right? And it's not that if you just knew what to do a little bit better, all your problems would be solved. That's one of many problems. And so part of this is making it easier for people.
Now, in your Series A announcement, you noted that there's research showing that 52% of employers do not track data on employees' caregiving roles. And, there's some privacy concerns there. Some folks, of course, might not want their employers knowing their personal details. But can you talk about that statistic and why it might be better for employers to be more aware of the caregiving responsibilities drawing on their workforce?
Definitely. So the data shows that up to half of employees don't want to report their caregiving status to their employer out of fear of retribution. And retribution has been on the rise. So those are pretty well-founded concerns, right? And then you see certain data that's come out of different groups like organizations related to cancer, where people feel that way with specific medical problems as well. And I think a lot of that comes down to their fear of whether employers are going to think that they're going to do a good job. Are they going to be able to be up to the task of the next big project, that next promotion? And given how much people feel pressured now to have two individuals in a household earning income just to be able to pay for the likes of care, that's really important for families. So I think for every family, people are thinking about that and thinking about how they navigate that. And if employers were to gather that data better, this is the biggest topic now that people are thinking about in terms of whether they leave a job. It comes everything from how your recruitment, your retention, your productivity, your growth in your career, time away in your career, the type of support that you need. So this is really what people's home lives are outside of work. And given how much the future of work has changed since COVID has happened, that's a really big deal for people to feel like they have support at home before they come to work every day.
So on that note, are you engaging employers through Grayce, or are you primarily B2C in your model?
We are B2B2C. So we sell to enterprises today, employers, soon health plans, and really helping people to navigate that as an overall entity and think about how they engage their workforce and how they support them to actually be able to keep those workers and to make that workforce more productive and more engaged.
So you are talking to the employers of America, but of course, you just said something a little bit earlier that I think is really important. More households are realizing you need both parents working to make ends meet. And I'm wondering, given some of the policy discussions that have arisen this election cycle, do you think both political parties are aware of that reality?
I think for many people, they come from different circumstances and don't necessarily appreciate the cost of care is untenable for people at every level of the economic strata now. And that's true whether it's childcare or whether it's elder care. You look at inflation and people talk about, oh, this is about the price of a gallon of milk. Well, if you think about what the inflation rate has been on the gallon of milk versus what it's been on childcare or elder care, it makes that gallon of milk or that gallon of gas look pretty cute in terms of the inflation rate. So this is something that's running away with people's time, with their money, right? People cannot afford care anymore. And that means that they can't afford the care is not available, and so they're doing it themselves, which takes them out of the workforce and prevents people from being able to achieve the American dream. So I don't think that necessarily every politician understands this equally. They may not all have the same lived experience. And then it all comes down to what are your other informal resources to support you. But for many families, that's not just going to be the likes of grandparents or siblings or friends or neighbors that can solve the intensity of what care is in America in 2024.
If every employer were to adopt Grayce or another caregiving benefit, would that solve the gap, or do we need a federal policy on this matter?
I don't think that private enterprise can do the entire job of what is partially the responsibility of the U.S. government. So I think to say that care is unlike, it's very much like healthcare, right? There is part public sector, part private sector. We can discuss what are the roles that each should have, but until you have a functioning care economy, it's very hard for the private sector to solve everything. That certainly does not mean that the private sector should just let everything happen and wait for the public sector to solve it, because it's a complicated issue and you need to run your business today. This is an issue that if people are not doing something about it today, it's affecting their business already, and it's one of the most costly areas to invest in.
I mentioned earlier that you announced a Series A round of funding a little bit earlier this year, just over $10 million. I'm wondering what you learned from those conversations with investors. Obviously, you got enough on board to get that funding, but were there folks who say the care economy isn't worth investing in, or, you're chasing the wrong issue right now?
We're definitely in an emerging space, and I think there's a lot of investors that don't necessarily understand it and don't necessarily care to understand it until it's already here. There's always going to be the crop of those that are looking at, what's new and what's coming. And then there's others that are really just looking for what's already here. For our space, I think it was about finding those that really believe in investing in large demographic trends, that really believe in investing in major societal issues, and that can see the types of business models that can operate in our current environment and how that could evolve over time and how this market will continue to evolve over time, and backing the right teams to do so. And so, like anything, right? Investing, it's always finding who are your right matches and people that believe in the future of how a market's going to evolve. But it's a lot more important to focus on a very large growing market than it is to just pick one that's enormous tomorrow.
That is a fair point. Now, you mentioned your own background in healthcare, but I'm curious, what was the light bulb moment for this company? Was there an inflection point in your life that you said, nothing else is working, we have to start this ourselves?
I don't know that there was one moment, but rather a cascading series of moments, honestly, through years. I think in some ways, I've spent my whole career really leading in the direction of starting something like this company. One, in terms of professionally, how I went into healthcare, right? I grew up with a loved one who had cancer and had no health insurance, and seeing how that affected not just my immediate family, but the entire extended family and the choices that everybody made, and how I felt about what the rights were of everyone to have access to healthcare. That definitely shaped me going into the industry. And then seeing how loved ones were not treated effectively through the course of the ends of their lives, and the challenging nature of the conversations my own family was having, and seeing that the healthcare system treated us as bystanders rather than key stakeholders and actually driving the outcomes of that care. Every single one of those moments from a personal standpoint, married with doing that in the professional world in healthcare, really said, this problem is not being solved effectively. And how do you think about building a business model that can harness creating the change that we need? And so, while feeling these things personally, I spent a lot of time through my professional experiences trying to understand, and through the lens of the ACA and how that changed all the payment models and giving me the opportunity to work in health insurance, which controls how the dollars flow, really seeing how can you then build the right business models to try to solve these massive issues that people are experiencing.
How do you get the insurance companies on board? I think that's my question for every single person in the healthcare or caregiving space. Are they open to a solution like yours, or is it fighting an uphill battle from your perspective?
I think different companies are trying to take different angles to the opportunity. Caregiving is, at the end of the day, that's not what you bill around, which in healthcare, how things get billed is very important. But number one, there's new government payment models that some companies are going after. Number two, there are things like supplemental benefits within Medicare Advantage, if they're focused on seniors, that some companies are going after. And then there's also being able to coordinate and navigate care. And so I think there's different solutions across the board in terms of how people are trying to tailor towards specific payment models. And there's not one right answer. And at the end of the day, it's really about how you engage a family unit to try to drive better care and a better experience.
Now, speaking of family units, I started this conversation by saying you are 8 months pregnant and navigating paid leave or leave yourself. You're going to have to go on at least a little bit of mat leave. But I talk to friends who say like, I don't want to take that much time, or I'm trying to draw boundaries, to set a model for other people, and B, to protect my own mental and physical health. So Julia, how are you navigating these very thorny issues? Because I recognize as a woman, it's possible to have a stance as a leader or as a thinker, but then when it comes to your own life, you might, make different choices. How are you approaching this?
Yeah, I think that's well stated, right? So it's, there's no easy answer. There's no obvious answer. I think particularly as a female founder, well, one, we can't ignore that there's less funding available to female founders, and that means you have tighter room to operate, right? You still have to perform while also trying to be supportive and draw boundaries for your personal life. So at our company, as of today, we're offering 12 weeks of leave. In my case, I will need to take a little bit less leave. And fortunately, I'll be doing it through the course of the holidays. And so that gives a little bit more buffer. But it's still important in particular, for me as a founder in a care-focused business to draw those boundaries, right? It's important for me personally, my mental and physical health. It's important for my family, certainly, and my child. But that's also important for our team and important for our industry. There's certain things that I've learned, it's not my first time through it. So there's certain things I've learned on how to do better each time. And I'll be applying all those lessons to help make that juggling a bit easier.
It's hard, though, because I think there are a lot of times, maybe not all the time, but for large stretches of a startup's life, being a founder and being the CEO of that startup can feel like a 24/7 job. And I know there's conversation about reforming the culture and work-life balance, but there are times that I wonder as a journalist talking to founders in the startup space, is it even possible? Is it just what's required to build a startup? Long hours, hard work, the elimination of personal boundaries. What do you think?
Again, there's no perfect answer. I think I'm fortunate, one, to have a co-founder who's also been through this journey. So we've leaned on each other at different chapters of the business. And two, we've got a great leadership team. And so knowing that we can plan, particularly as we're going into a new fiscal year, really thinking about what are those key goals, being able to then step away on things, that certainly helps. But also, it's when you are a founder, there's certain ways that you'll juggle your time in terms of thinking about how you can pay attention to the business when it's really critical, right? And levels of escalation and what's needed. And having a period of time, there is a period of time when you come home from the hospital and you need to be 100% focused at home. And then there's the period of time where, as every mom will know, right, you're nap trapped in those early days. And, you can't nap yourself. So in many cases, you've got some time to really be able to answer some of those critical questions. That does not mean that you are on Zoom all day long. That does not mean that you're flying cross country all day long, but you certainly can keep things moving. So I'll really be looking at that from my own standpoint as a phased approach to making sure that people have the amount of support that they need from me while being able to lean on the talent that we've really brought to lead that next chapter.
Nap trapped. Is that a Julia phrase, or is that something that exists in the parenting space? Because I love that. I've seen the comics, the cartoons about sleep when the baby sleeps, eat when the baby eats, cry when the baby cries, because the point is how hard it is to just take that, I guess, long-standing advice that is often given to women.
I wish I could claim that nap trapped was something that I came up with, but no, that was something that I learned is well known, and is something that this time I'm going to do my best to not be frustrated by. Because, when you think about being a type A individual who starts businesses, right, you think about someone who wants to be able to get things done. And in some ways, being nap trapped is really nature's way of reminding you that there are other things that are important at certain points in time. But those naps can go on for quite some time. So being able to have something else that you can do with your time can be useful when you need to.
So we know what's next for you personally, given that you are, roughly speaking, given that you are 8 months pregnant. But in terms of the company you have co-founded and are leading, you raised the Series A earlier this year. What's next? If we were to speak a year from now, what do you hope to be able to say to me? And also, how does the coming election affect those forward plans?
I'd say the coming election right now, we are gaining steam on talking about this topic in a way that we have not in any recent memory in any of our lives. And so certainly we have the promise of being able to tackle some of these big challenges to try to make care a bit more accessible and a bit more affordable. That does not mean that we will solve all of the care issues. If anything, that's just going to then create the entree to be able to focus on some of the next big era challenges, which are all of us are becoming caregivers. We're all caring for someone based on how our demographics are changing. There's no way around it. But when we think about what that means there's more opportunity then to focus clients and businesses on this topic and making progress on it, really understanding what people need, being able to start addressing some of those needs. And for us as a company, it won't just be solving those problems for employers, but also solving those problems for health plans and thinking about more ways to solve more of the challenges within caregiving, because it's pretty consummate as an individual. This is really about your life, right? It's fundamentally human, who you love and who you care for.
Excellent. Well, Julia Cohen Sebastien, thank you so much for joining us. We so appreciate your time, and best of luck on your upcoming mat leave and with the birth of your child.
Thank you. Yeah, great to chat with you today. Thanks, Maggie.